I'm Dr. Lloyd Darlow, VP of Clinical Integration at Cayuga Medical Center and the President of the Cayuga Area Physicians Alliance in Ithaca, New York. I'd like to welcome you to this training video for the Cayuga Area Plan, Cayuga Area Preferred Clinically Integrated Network and Accountable Care Network known as CAP. The purpose of this video is for you as a new physician to understand the organization that you're joining, what impacts the organization has on healthcare in this area, and what the organization can do to help you as a physician function in a much more collaborative environment. Let's start by giving you an idea of who CAP is as an organization. We've been present in the Tompkins County area for more than 20 years as an organization that is 50% owned by the hospital, Cayuga Medical Center, and by the physicians organization that is known as the Cayuga Area Physicians Alliance, or CAP-A for short. Cayuga Medical Center is a private independent hospital in Tompkins County that has 5 major locations. The main hospital, which is located at 101 Dates Drive in Ithaca, but also has several other freestanding locations that include 2 urgent care centers, a radiology building, and a comprehensive center for health and wellness called the Cayuga Wellness Center. The Cayuga Area Physicians Alliance is an independent physicians organization of 200 plus physicians. About 45 at this moment are primary care doctors spread out among 15 practices, and then plus 160 physicians that are spread out among another 30 or so practices. Since the organization is co-owned by the physicians and the hospital, each 50%, this to me shows that both organizations are significantly invested in the health and well-being as well as the running of the organization. CAP's mission is to unify its member organizations, Cayuga Medical Center and CAP Alliance, in the pursuit of high-quality, accessible, and cost-effective healthcare for the population of patients that we serve. Our vision is to be a responsive and clinically integrated network that is known for the superior patient experience, healthcare outcomes, accessible healthcare, and cost-effective care. And the network will be chosen by patients for the high quality of care they receive, physicians for a collaborative and patient-focused environment, employers for a healthier workforce, and also by payers for the collaborative relationship that they have with our providers and the hospital. In 2010, CAP began working towards the goal of becoming a clinically integrated network. This is a term that many physicians think came into being around the time of Obamacare, but in fact, the term clinical integration was coined by the Federal Trade Commission back in 1996. In order to meet the burden of the definition of clinical integration, an organization has to show that the physicians are working in a manner that is both cooperative and interdependent, with goals of providing healthcare that is the highest quality, but also one that has the kind of infrastructure in place to support those activities. CAP provides a mechanism for healthcare providers, whether they be contracted to the hospital or working in an independent practice, to collaborate in order to improve healthcare outcomes. Participation in this program must be voluntary, but all physicians understand that they are accountable to certain performance and quality metrics that make the organization as effective as it can be. As you can see from this slide, CAP as an organization is heavily governed and operated by the physicians. There are 5 physician committees, each comprised of a minimum of 6 physicians. They include clinical guidelines, performance improvement, contracts and finance, primary care operations and care management, and information technology. On the right side of the slide, you can see some of the infrastructure that goes into the day-to-day operations of the CAP network. I want to call particular attention to the fact that we have a very robust care coordination program, which I'll be discussing later on in this video. CAP also has a very robust program in business analysis and data analytics, and we'll be discussing that a little bit later as well. The CAP network is currently responsible for the bulk of healthcare that is practiced in the Tompkins County area. We're responsible right now for about 40,000 covered lives in our region. We do this by contracting with the major healthcare payers in the area on a program that heavily focuses on our performance on quality metrics. I think one of the main benefits of our organization is that our size enables us to provide a certain degree of mobility and agility. It's no secret to physicians that the healthcare marketplace is one that changes on a regular basis. But our size and our technology, the commitment of our physicians, and also the support staff enable CAP to be an agile, independent thinking, and forward-looking network. Some of the benefits that a physician will gain by joining the CAP network include, as I've stated, the ability to collaborate with an outstanding physician community. Many of our physicians have served as chief residents in their training programs and come from some of the best programs in the United States. There is access to both care coordination resources, as I've mentioned, but also to quality improvement and to business improvement analytics and assistance. CAP offers its physicians a rare chance to engage in leadership opportunities. Usually physicians have to wait a long time to become leaders in an organization, but CAP looks to new and younger physicians to assume those leadership roles very early on. It is very easy for a physician in the CAP network to feel as though he or she is making an impact into the community in which you serve. CAP pursues contracts with commercial and governmental payers that recognize the high value of the care that we provide, and because of that, provide us with favorable reimbursements. These contracts are non-exclusive. Providers are free to sign agreements with any organization that CAP does not already have an agreement with. This slide shows some of the organizations that CAP currently does contract with. CAP's contracts are based on value-based purchasing arrangements. This involves a measurement of qualitative quality metrics and also financial performance to an agreed upon budget. One of the key measures here is that patients are attributed to CAP providers. As patients are attributed to a specific CAP physician, it becomes ever more important, whenever possible, for CAP physicians to refer patients within the CAP network. Only by keeping patients, whenever possible, within the network can we assure that quality metrics are being followed, access to care is being addressed, and proper utilization is being followed. But success in these value-based arrangements can only be assured when an organization provides its physicians with the structure, technology, and support that CAP provides. You've already seen some of the governance, physician committees, and boards that are involved in the CAP network, but the organizational support that CAP provides is second to none. Our staff are expert in advising physicians regarding contracts, data and analytics, best practice standards, care management, and also in-network referral management. Your orientation packet and spending some time with the CAP website, www.capny.com, can show you the various services that are provided within our network, which are fairly extensive and comprehensive. Last but certainly not least, I want to talk about CAP's care management program. Care management exists to try to improve the coordination of care between patients, providers, offices, and hospitals. Our care management team of nurses reaches out to both patients, families, and providers alike. They'll provide care to patients if they're in the hospital, but also if they're seen in the patient's office. The idea is to try to identify those patients who need a little bit of extra care to try to navigate the complexities of the healthcare system. For those physicians who utilize an electronic medical record in their practices, our care management nurses have access to those records. Each CAP practice is assigned a care management nurse who is integrated into the practice and works with the patients, again, who require a little bit of extra care to help navigate their healthcare difficulties. I'm very proud of the advances that CAP has made since we started functioning as a clinically integrated network in 2012. Working together in a cooperative manner, we have provided our patients with the highest quality health care while also trying to make that care accessible and affordable to our population. Working together, we have moved healthcare in a direction that we can all be proud of. CAP has assembled a medical staff that is second to none and a support staff that is technically superior. Once again, I recommend that you look at the CAP website, www.capny.com, where you'll find out more about your colleagues, where they trained, where their practices are located, and what kinds of services they provide for our patients. Your orientation brochure contains useful contact information in case you have any further questions. On behalf of your colleagues, welcome. We're glad that you're here, and we look forward to a long collaboration as we continue to advance healthcare in our community.